Well, it's Breast Cancer Awareness Month, and almost 1 in every 25 women are likely to be diagnosed with this kind of cancer in their lifetime. It's Dr. Charles Serrurier, the first cosmetic and reconstructive plastic surgeon in South Africa to provide a diagnosis and a plan in one day. He joins us here on the show. Dr. Serrurier, good to have you with us. I had the pleasure of coming through to your unit just a little while ago, and it's a newish unit as well. But before we talk about how you're able to do a treatment plan and a diagnosis in one day, or as close to that as possible, when it comes to testing, it still seems most women and men, we must talk about breast cancer for men as well, I'm sure, don't test regularly. What's your view on that?
Yeah, look, COVID's caused absolute havoc with the breast cancer screening within South Africa and also the world. And that's one of the reasons why I thought it would be important, with Breast Cancer Awareness Month being this month, obviously, is to get out there and really encourage people that have been behind on their screening for COVID because they're frightened and stuff like that. If you are behind on your screening, please get out there, access your nearest mammographic facility, fantastic ones all over the country, really good one attached to our unit, Breast for Life, and catch up with your mammography. It's absolutely vital that we continue with good, proper medicine. And in these units, everybody's had vaccines, basically. So it's much safer to go for your screening than it is to go to the supermarket, to tell you the truth.
Let's talk about ages. At what point and at what age should someone start testing for breast cancer?
Okay, routine screening guidelines are slightly different in different areas of the world. But generally in South Africa, we'll perform the woman's first screening event at the age of 40, the second one at 45, and then yearly to 2 yearly after 50. And that results in earlier pickup rates of cancers. And obviously, if you pick something up earlier, the treatment pathway is less complicated, less involved, and the outcome is much better. It's good, solid medicine.
Let's talk about those treatment pathways, if we can. This unit of yours just down the road here in Rosebank, by the way, able to do this very, very quickly, because that seems to have been a problem in years gone by in other countries. It can take a long time to get a diagnosis and then a treatment plan.
Yeah, well, that's the worst thing, is that woman feels a lump in her breast, off she goes to a screening facility, they screen her, they might not have the appropriate radiologist that can do the biopsy, she's got to come back. Then what happens is it will then go, the specimen will go to the laboratory where it gets analysed to determine, is it a cancer, is it not a cancer. The results then come out, patient comes back for the diagnosis. What we've instituted is a day diagnostic service. So if the patients get to us early in the morning, they'll be seen by either one of the radiologists, potentially myself. We've got a couple of slots every morning for mammography and ultrasound, and the biopsy will be performed. And then in conjunction with one of the new laboratories in Johannesburg, QLab, we are able to then process the specimen within about 4 to 5 hours, and then within a working day be able to say to the patient, yes, Mrs. X, unfortunately it is a breast cancer, or no, Mrs. X, it's good news, this is a benign biopsy.
And once we have a diagnosis, in this case for Mrs. X, there is a cancer diagnosis. Your unit goes beyond, I'm sure, the diagnosis. We now get into this treatment plan as well. You don't just sort of, send them your best wishes and send them off to another specialist. You walk that journey with them.
Yes, yeah. Well, we're a fully integrated multidisciplinary unit with oncology, radiation oncology, health, wellness, survivorship, physiotherapy, lymphedema therapists. And what we do is we sit once a week and we all get together and we discuss the individual patient. It's called a multidisciplinary team. And a lot of breast cancer in this country is done like that, and all breast cancer should be done like that. Then what we will do is determine what the patient needs from an oncological point of view. Do they need radiation? Do they not need radiation? Do they need chemotherapy? Do they not need chemotherapy? And then what we will do is we will institute a treatment pathway which is unique and particular to each patient. Some patients might need to start with chemotherapy. Some patients might start with surgery.
Let's talk quickly, before I let you go, about Breast for Life. It's just opposite the Rosebank Hospital, so nice and close to other medical clinics as well. Self-examination. I mean, someone might be watching now going, well, I don't know if I should go for a test or come and see someone like you. What are the warning signs? Very quickly, Doctor.
So self-examination should be performed on the 7th day after your menstrual cycle, if you are menstruating, or at the same time every month if you're postmenopausal. And what you need to do is you need to look at your breasts in the mirror, okay, make sure there aren't any changes. Is the nipple retracted? Is there obvious skin change? And then palpate the 4 different quadrants of the breast with 3 to 4 fingers, feeling for any different changes. And if you're at all concerned about anything, trying, then what you should do is you should access your screening facility.
Well, I appreciate it, and thanks very much for coming in to speak to us. Dr. Charles Serrurier joining us from Breast for Life. It is an oncology unit just down the road here in Johannesburg, in Rosebank. He's an oncoplastic surgeon. It's quite a title as well, able to do a diagnosis and come up with a treatment plan in the same day. My thanks to Dr. Charles Serrurier.